the guideline sessions, we call them interactive guideline sessions because in order to make guidelines closer to people and to help them in taking decisions. So what we do is we have a clinical case presentation and after that there is a person, an expert, discussing on how the clinical case was treated. So this is in Europe when we have our standard congress, a young person is doing the case presentation and then normally one of the lead authors of the guidelines is commenting and discussing on this. In order to involve people from Asia in this process, we are going to do it in a different way. So we have a European expert who is going to present a clinical case. Normally the presenter is involved in the elaboration of that particular guideline, and after that an Asian opinion leader is going to discuss on how this particular patient was treated. The aim of this is that they could take into account how ESMO guidelines are written and what are the recommendations we provide in them, but also to get the flavor how clinical practice could be different in Asia and how we can try to make this gap closer. In some diseases, in some cancer diseases, we have a different histological classification, different staging system, although the drugs and the tools we have to treat these patients are very similar. So I think we have to learn from each other the best way to do it. And also there is a very nice cooperation, particularly in determining the molecular classification of tumors, because those tumors are coming from different databases from Asia and from other European or Western countries like US, trying to get a full picture of what is happening. So this is, I think, one of the positive things I see of this meeting, that we are closer to discuss our science and also to make closer our clinical practice.